I'm very happy to be able to participate in the upcoming RAIN meeting that will be organized by Dr. Santos Joseph in Chennai from November 13 to November 16 of this coming year, 2014. I look forward to participating in that meeting, and I think it's going to be a very good, comprehensive meeting, both for people starting in interventional procedures as well as for experts, physicians that have been doing this for a long time. I think the way Dr. Joseph and myself and Dr. Michel are going to work this meeting such that it will include a variety of lectures, didactic lectures that deal with flow diversions, the indication of flow diversion, and the potential complications and risk of flow diversion, as well as the advantages of flow diversion in the treatment of aneurysm. We also have lectures on the treatment and the management of acute stroke, both the advantages and the relative disadvantages that have been actually reported in the IMS-3 report that came out from the United States. We will also discuss all the various new devices that are being used now in mechanical thrombectomy. More importantly, also there will be a session on how to set up an effective and efficient stroke center, much similar to the stroke centers that have been set up over the last several years in the United States. In addition to these lectures, there will be several roundtable discussions also discussing controversial issues such as the value of mechanical thrombectomy in acute stroke and how to set up the indication for mechanical thrombectomy. There will be also sections discussing PL arteriovenous malformation, how to treat them, what's the proper way of treating them, especially setting up the indication in view of the recent results and studies such as the Aruba trial. And there will be a lot of discussions on that trial and primarily on how to set up the indications for treatment of a intracranial PL arteriovenous malformation, and primarily how to compare the potential risk and complication of treatment versus the natural history of intracranial PL arteriovenous malformation. There will also be a discussion and live case demonstration of dural arteriovenous fistula. What is the proper way of treating dural arteriovenous fistula, either transarterial or transvenous, and the latest development in the delivery of onyx and dural arteriovenous fistula, such as the use of balloons and other detachable tip catheters. The live case transmission will include, among others, carotid angioplasty and stenting, with discussion of the various devices and distal protection devices. There will be also several cases transmitted from Chennai and from other centers in India dealing with the flow diversion and the treatment of challenging aneurysms and several other cases. There will also, we will organize a roundtable discussion also dealing with all of these hot topics today that are being discussed for the treatment of cerebrovascular disease. So I expect a very exciting, very educational and informative meeting, a very collegial atmosphere where people can ask questions and about the tools that are used for each case and just justification for those tools, as well as the goal of treatment for each case and setting the indication of treatment for each case. So I look forward to that meeting. I look forward to seeing you over there, and I think it promises to be a great educational